Hello, welcome to Keeping Our Pets Safe During COVID-19. I'm Dr. Sandra Manus, and I own Cedarwood Veterinary Hospital in Newport, Tennessee. The beta coronavirus that causes COVID-19 is SARS-CoV-2. The virus appears to have originated in horseshoe bats in China. There's a lot of speculation about how this virus evolved into the current COVID-19 in humans. I'm sure by now many of you all have heard about the speculation about the pangolin and the speculation that possibly it was stray dogs. Whatever the mechanism of transformation of this coronavirus to the current SARS-CoV-2 is unknown at this time. What we do know that it is very contagious from human to human. As of April 24, 2020, there are 910,000 cases confirmed in the United States alone. Worldwide, there's almost 2.8 million cases. This disease may be spread by people who are not even showing symptoms. COVID-19 is spread in the air by human body fluids, particularly saliva, mucus from a cough or a sneeze. It's thought that COVID-19 can also be spread by touching a contaminated surface or object, and then touching your mouth, nose, or eyes. Smooth, non-porous surfaces such as doorknobs and countertops transmit the virus better than porous materials such as pet fur or paper. This means that smooth, non-porous surfaces can actually hold the virus longer. The virus can live longer and therefore be transmitted to another person. At this time, there is no treatment for COVID-19 other than supportive care. There is no vaccination at this point either, but there will be in the future. So how do we prevent the spread of COVID-19? Do our part and stay apart. If at all possible, avoid people who are sick. If you are sick, please separate yourself from your family members and your pets. Please practice social distancing 6 to 10 feet from people and animals who are not part of your family. Cover any cough and sneeze the correct way. If you must go out in public, wear a mask if at all possible. Wash your hands for 20 seconds with soap and water or use a 60% alcohol-based hand sanitizer. Plain old household bleach, a 1/3 cup per gallon of water, will kill COVID-19 within 1 minute of contact time. Even though there's been over 2 million cases of COVID-19 by April 24, 2020, there's only been 2 dogs and 1 cat in Hong Kong, 2 cats from separate households in New York, and a tiger in the Bronx Zoo that have tested positive for SARS-CoV-2. These are cases that occurred under natural conditions, and all these animals have recovered or are expected to make a full recovery. At this time, there is still no evidence that animals play a significant role in spreading the virus that causes COVID-19 to people. We do know that people can, in some cases, spread the virus to some species of animals. We've already seen this in the past few months with the reported cases of animals in Hong Kong and in New York. There is no reason to test your pet for COVID-19 unless you have discussed this with your veterinarian and other causes for disease have been ruled out. So how should we protect our pets? Pet parents without symptoms of COVID-19 should use good hygiene. Wash your hands before and after handling your pet. Don't cough or sneeze on your pet. Those humans who are COVID-19 positive or those who are in quarantine due to exposure to COVID-19 positive people should restrict contact with their pets and other animals if at all possible. If you must care for your pet, wear a face mask, don't share food, don't kiss, don't hug. Wash your hands before and after you handle your pet. For all pet lovers at this point during the pandemic, don't allow your pets to interact with people or other animals outside of your household. Keep those sneaky cats indoors if at all possible to limit their interaction with potential risk. Walk your dogs on a leash and maintain 6 to 10 feet between you and other people or animals that might be around you and your pet. Do not bring your pet with you to public places during the pandemic, unless it's a service dog. So what is Cedarwood Veterinary Hospital doing to help control the spread of COVID-19? We have pet valet curbside pickup and drop off. We come to your vehicle and take your pet to an exam room to perform necessary treatments. We offer call ahead medication and food pickups, and now it's curbside. We have our online pharmacy available through our website if you don't feel like getting out. We don't allow your pet to come in contact with any other animals while in our hospital. While your pet is in our care, we are fully gloved and face masked. Each exam room is thoroughly disinfected between patients. We are offering telephone and video consult calls by appointment so that you may avoid a trip to the vet hospital. We have 2 teams of doctors and technicians who alternate days. This way, we minimize the possibility of having a shutdown of the hospital due to COVID-19 exposure. No one except the patients, doctor, and support staff are allowed in our building at the present time. We will not be changing our current COVID-19 protocol on May 1st. We will continue to reassess the daily state and nationwide situation before making any decision which may affect the health and safety of your pets and our community. As always, be kind to each other, but especially be kind to the animals.